Welcome to the Center for Special Minimally Invasive and Robotic Surgery with Dr. Camran Nezhat. Today we're going to review your surgical plan, sign your consent forms, and review all your surgical preoperative and postoperative instructions. We're going to send you all your prescriptions for your surgery to your pharmacy today so that you can pick it up prior to your surgery. We're also going to provide you a paper prescription for your narcotic. Please don't lose this, as this can only be written on paper and the pharmacy will not allow an electronic order. You're going to receive a call from the surgery center the day before your surgery confirming your arrival and surgery time. If you have any medical problems like high blood pressure, diabetes, or thyroid problems, we do require that you obtain a letter of clearance from your primary care physician. Dr. Nezhat will be your surgeon, but he does have a team of fellows and assistants that will help him during surgery. He has 2 fellows and also his niece, Dr. Nezhat, who will be assisting him. Please do not take any vitamins, supplements, ibuprofen, aspirin, or herbs for 2 weeks prior to surgery, as these medications can increase your risk of bleeding during surgery. Please consult your doctor regarding the rest of your normally scheduled medications, such as for high blood pressure, diabetes, or thyroid problems. Please remove all jewelry and metal from your body prior to surgery. You may wear makeup or nail polish the day of your surgery if desired. Please have light meals the day before your surgery. Our carbohydrate-rich diet is encouraged, as this will help the healing process. Please avoid red or blue food coloring the day before surgery. Please do not eat or drink anything after midnight the day before surgery. You can take your medications the morning of surgery if needed with a small sip of water. A saline fleet enema is recommended the night before surgery. We recommend this to allow him to visualize the rectum more easily on proctoscopy. However, if this is too difficult for you, this is not required. Medications to take before surgery. We're going to give you all of these medications the day of your pre-op. You'll receive Cytotec, which is a medication to place in the vagina the night before surgery. This medication is going to soften and dilate your cervix so that we may see inside your uterus more easily. This may cause some vaginal bleeding and cramping like menstrual cramps. If needed, you can take Tylenol for the pain, but please do not take any ibuprofen or naproxen. You're going to receive a prescription for Peridium. This is going to turn your urine orange. Please take this medication 2 hours prior to surgery. This is so that he can evaluate the ureters more easily during cystoscopy. You may also take this medication for 2 days after surgery if needed for burning when you pee. But please do not take this medication more than 2 days, as it may be an indication of a urinary tract infection and will need evaluation. It's important to breathe deeply for 1 week prior to surgery and after surgery. This is to prevent infection and collapse of your lung. If you have any questions, please do not hesitate to reach us at our office, or after hours, you may reach us with the on-call paging system. The standard follow-up appointment will be 4 to 6 weeks post-operatively, unless Dr. Camran Nezhat tells you anything differently. We will also give you your medications that you are going to take after surgery. These include ibuprofen, which you may take for pain, oxycodone, which is a narcotic and you may also take this for pain. Omeprazole is a medication that you can take as needed for reflux. Zofran is a medication to take for nausea. Colace is a stool softener that you should take every day, even if you're not having bowel movements. This is so that when you do have a bowel movement, we do not want you to strain during your bowel movement. If you are having a appendectomy, we will give you an antibiotic called Cipro, and if you're having a hysterectomy, we'll give you an antibiotic called Keflex. Do not be alarmed if you do not have a bowel movement for 3 to 7 days following your surgery. You should continue to take the Colace, eat a regular diet full of fiber, water, and if needed, you can take some laxatives, stool softeners, or prune juice. You should be passing gas within 1 to 2 days after your surgery. It's normal to have some light bleeding after surgery. Dr. Nezhat puts a large amount of fluid inside your uterus during the hysteroscopy, and so it's normal for a lot of that fluid to come out for a week after surgery as watery pink discharge. Your first 3 periods may also be irregular both in timing, amount, and pain. A lot of patients do experience that their first period after surgery is quite heavy and painful. If you ever experience bleeding heavier than a period, please call our office or the answering service. If you're having a hysterectomy, please do not put anything in the vagina or do not have intercourse for at least 6 weeks and until you're cleared by your doctor. A lot of patients experience gas pain after surgery. Due to the laparoscopy, we do put gas in the abdomen to distend it. We try to remove as much of the gas as possible, but inevitably some of the gas will remain. This gas can cause irritation, causing chest and shoulder pain, especially on the right side. This can last up to a week, and the best thing for this is to walk and just let the gas dissolve. For bloating and gas pain, you can also take Gas-X, chewing gum, or hot tea. A sore throat may be experienced due to the intubation from surgery. You can take Cepacol or over-the-counter lozenges. After surgery, our goal is to have you return to a regular diet as soon as possible. If you're hungry and passing gas, we recommend that you resume a regular diet. But please do not force yourself if you're feeling nauseous, bloated, and not passing gas. Start with a liquid diet and advance slowly. For most cases, we recommend no vigorous exercise or sexual activity for at least 1 to 2 weeks after surgery. It is normal to have some swelling, redness, and bruising around your incisions. You'll have steri strips placed over the incision, which should be removed after 7 days. Please do not keep them on more than 7 days, as they can get dirty and infected. Over the steri strips, you will have gauze bandages that should be removed after 48 hours. You also have dissolvable stitches inside the incision that will dissolve after 4 to 6 weeks and do not need to be removed. The belly button is like a cup and holds a lot of moisture and can get infected very easily. Thus, it's very important to clean your belly button as thoroughly as possible. Clean it with soap and water, dry it with a clean, dry towel, and then blow dry it with a hair dryer. Do not use Q-tips to probe the incision vigorously, as it can break the incision open. Prior to surgery, you should also make sure that you clean your belly button very thoroughly. We recommend a HIPAA cleanse shower that you can purchase over the counter at any pharmacy. You can shower as often as you like after surgery, starting 24 hours after surgery. We ask that you do not sit in a hot tub, bathtub, or swimming for the first 3 weeks while your incisions are healing. You may also be sent home with an abdominal band to help support the abdomen while you walk. Please only wear this for limited periods during the day, as it can also trap a lot of moisture and sweat and cause an infection. Most patients feel well enough to return to work after 1 to 2 weeks, but by law you are allowed up to 6 weeks off. Please do not drive while you're taking narcotics, and if you're in a lot of pain, please use your judgment while driving. Preferably, please do not travel for 1 to 2 weeks after surgery if you can help it. If you have any symptoms such as fever, heavy vaginal bleeding, severe abdominal pain, intractable nausea and vomiting, or suspect that your incisions may be infected, please give us a call right away at our office or the after hours pager number. We wish you a speedy recovery, and please do not hesitate to call us or contact us if you have any questions or concerns.